Ever wondered what makes a healthcare professional truly proficient in their field? Their mastery of clinical skills is a key component. Today, we delve into the core clinical skills that every healthcare professional should master. First up, wound care. This involves assessing the wound, cleaning it, changing dressings, and measuring the wound. Each step requires meticulous attention and precision to ensure optimal healing and prevent infection. Next, we have medication administration. This can be quite complex as it involves different routes such as oral, intravenous, intramuscular, subcutaneous, and intradermal injections. Each route requires a unique technique and understanding to ensure safe and effective administration of medication. A comprehensive physical assessment is another crucial clinical skill. This includes a head-to-toe physical assessment, vital signs measurement, and the assessment of various bodily systems such as the neurological, respiratory, cardiovascular, gastrointestinal, and musculoskeletal systems. Urinary catheterization is a procedure often performed in healthcare settings. This involves the insertion of urinary catheters, with procedures differing slightly for male and female patients. Nasogastric, or NG tube insertion, is another important skill. This involves the insertion and placement verification of NG tubes for feeding or medication administration. IV therapy is a common procedure in many healthcare settings. This encompasses IV cannulation, fluid administration, medication administration, and the care of IV lines. Tracheostomy care involves the maintenance, suctioning, and changing of tracheostomy tubes. This is a delicate procedure requiring careful handling. Cardiopulmonary resuscitation, or CPR, and basic life support techniques are life-saving skills. These techniques vary for adults, children, and infants, and they are essential in emergency situations. Oxygen therapy, which involves the administration of oxygen via various delivery devices, is another crucial skill, particularly in respiratory care. Lastly, maintaining sterile technique during procedures such as wound care, catheterization, and dressing changes is critical to prevent infections. In summary, clinical skills range from wound care to medication administration, physical assessments, catheterization, tube insertions, IV therapy, tracheostomy care, CPR, oxygen therapy, and maintaining sterile techniques. Mastery of these skills is what sets apart a competent healthcare professional. Each skill requires meticulous attention to detail, understanding, and practice, which ultimately enhances competency and confidence in clinical practice. Remember, practice makes perfect, and with each step learned and mastered, the journey to becoming a proficient healthcare professional becomes smoother.